Hi everyone, I wasn't going to make another video until after Tuesday when I've been to see the private doctor in Cardiff about Lyme, but I had my visit yesterday to the National Hospital for Neurology and Neuroscience at Queen Square, London. And I thought I would just make this video to sort of update you, and while things are sort of fairly fresh in my mind. It was quite a difficult day anyhow, because it's a good 50 miles by train to London, and then there's the journey across London, and by the time I got to the hospital I was in quite a bad way. My speech was particularly bad, and so were my movements. I had the last appointment of the day, so everyone was already starting to leave when I got there. But I saw another of Professor Wood's registrars yesterday, and she was extremely nice, and she seemed to be quite kindly towards me. She didn't seem to have had time to have read my notes fully, but she asked me if I knew what they were suggesting was wrong, and I told her I'd already had the letters about seeing a psychiatrist, and that they were saying it was conversion disorder, psychogenic, and all of this sort of stuff. And she come out with well, actually what's wrong is that it's functional. Now I already know that functional's a code name for the same thing, but she was very, very nice. She didn't do any more examination. I explained my reservations about seeing a psychiatrist. It was good that my wife was there with me to back me up. She's known me 30 years, and she's seen the changes that have happened in my life over the last 2.5 years. So that was helpful in the first place, to have her there backing my story up. Anyhow, the neurologist did say that there were a few illnesses that can manifest as being with what seemed like functional symptoms, but there were actually physiological tests that could be done for it. And she wants me to see, she's writing to my doctor about having some blood tests for these particular illnesses. They're not, she didn't say what they were, but they're not standard tests, but she would have had them done there and then, but the phlebotomist had already gone home, so she couldn't get them done there and then. And she did say that my GP would have to, should be able to find a specialist laboratory that does these tests. So that was positive, but she wanted to give me something off of the internet which explained functional illness, and she said there was a really good article. Well, she couldn't get the printer to work, so I got home and went on the internet, and I've put the link alongside this video. Now it's by a group of doctors, but Dr. John Stone, who is a neurologist in Edinburgh, and I'm sure anyone who has had ME has heard of Mike Sharp, are the editors of this paper. But it actually appalled me, because basically, now to be fair, John Stone has been doing studies on what are considered to be functional neurological symptoms, and has found, using fMRI, and has found some correlation between neurological between symptoms and the neurology of people's brains. So to be fair on him, he is a doctor who's researching this particular thing, and he does seem to be saying that that there is care that needs to be taken in this area. But the rest of the article was really about telling doctors to basically lie to their patients, because rather than use what they were saying was rather than use words like psychological or psychogenic or hysteria or conversion disorder, which are obviously heavily psychiatrically weighed, to use the word functional. Now, the purpose wasn't that neurologists should therefore recognise that there was something physically wrong. It was just a ploy to make it easier for patients to accept the diagnosis and make it easier basically on the neurologist and doctors. And I just found the whole thing quite appalling, that to tell doctors to basically lie to their patients I find quite contemptible. It also suggested that when trying to encourage patients to take antidepressants, of course we are all depressed, you know, if you got an unexplained neurological condition you must be depressed, but the way you get patients to take antidepressants is to tell them that it is having an effect on your central nervous system. Now, this isn't that they believe it really is, it's just to get you to take them. And my heart just sank. I'm not sure why the neurologists thought that I would find this helpful. If anything, it made me fume. In fact, it made me fume so much I emailed Dr. Stone and told him what I thought about it, which I'm sure he will take as absolute proof that I'm a psychiatric case. I've given him the address of my YouTube video log, so I said to him that I'm sure his psychiatrist friends would have a field day psychoanalyzing me. But I find this appalling. I would suggest you read the article that I've left the link for and just see what your view is. If you go to a neurologist and they mention the words functional, don't believe that they think that there's anything really wrong, because they don't. They think that it's all in your mind. It's not real. So don't be hoodwinked into this. And if they tell you to take antidepressants, you know you're not depressed, and they're saying it has an effect on your central nervous system, just ignore it, because it is a load of lies. It's just to make their job easier and to try to ease you and to get rid of some of this excess stress that's causing your symptoms. So it was part positive in that they're going to do a few more tests, part negative in that this article is just absolutely appalling. And I was promised by this neurologist that she told me that at the National there's no way that I would be labelled with one thing and never followed up. I've gotten a follow-up appointment for 6 months, but interestingly she never did one more neurological examination on me, so I'm not sure how they're going to monitor it. I think again this is just a bit of, we make sure it keep him sweet and make life easier for us and show ourselves to be caring, but actually we've discarded the guy because he's psychologically flawed in some ways. So just beware. I will update you when I go to see this doctor about Lyme disease on Tuesday. As I said before, I'm not sure that it really is that, and it's probably clutching at straws. I mean, there is still the whole thing with the flu vaccination and the possibility of that being having been contaminated, that I don't think has been ruled out. I'm not sure that anyone has done any blood tests to test for viruses or the bacteria. So that is obviously something that does need, I think, needs to be done. Well, that's it. I won't bore you any longer with more, and I will get back to you after I have had my my visit to this private doctor. I'll speak to you sometime at the end of the week. Thanks for watching. Bye.